Now, some problems that can occur over the holidays could involve a little too much celebrating. It could cause some health issues this holiday season. And our next guest joins us to talk about recognizing some of the signs of holiday heart syndrome and, more importantly, perhaps how to increase your chances of staying healthy throughout the season. Our friend Dr. Warren Levy, a board-certified cardiologist and chief medical officer at Virginia Heart, joins us once again to talk about this. Happy holidays.
Good morning, Steve. Happy holidays.
Let's hope that they're happy holidays for a lot of people. You know, we all feel stressed out, I think, during the holiday season, but we might not realize some of the startling statistics when it comes to cardiac health in the holidays.
Absolutely, and I think you hit the nail on the head. As you mentioned during the intro, the greatest number of heart attacks occur right around the winter holidays between Christmas and New Year's. And we've tried to figure out why that is, and I think it's several things. One of them, and probably the most important, is actually stress. People do get stressed out over the holidays. It's a fun time of year, but you have family visiting, you're getting ready for the holidays, preparing meals, buying presents, and that combined with probably too much eating, too much drinking, overexertion. You may be wishing for a white Christmas, but if Tony gives us that heavy, wet snow, you probably shouldn't go out and shovel it if you're not used to that level of exertion. And the other most important thing is people tend to delay seeking medical care over the holidays. They want to hold out. They don't want to ruin the holidays for their families and friends, and they wait a little bit too long to get in for attention.
Now, before we get to recognizing some of the things that we can do about it, does the cold weather in itself play a role in this at all?
Well, that's another very good point. Cold weather does increase the work of the heart. But interestingly, heart attacks increase over the holidays even in warm weather regions as well. But that typical picture of a man with a cigarette sticking out of his mouth, shoveling snow in the cold, absolutely those things do predispose to heart attacks.
But it seems like that stress is really, really a major role.
Stress is really number one.
What can we do to take the stress off of our bodies and our heart, not just our mind?
Well, I think people need to be aware of when they're feeling stressed. And it's not uncommon over the holidays. And if you're feeling stressed, take a time out. Go upstairs, lay down for a few minutes. Maybe you need to get away from your family for an hour. But be aware of what your body's telling you. If you feel your heart rate increasing, you're getting a headache, go lay down, go relax, and don't overdo it. If you're not used to drinking alcohol, don't drink a lot of alcohol. In fact, there's a syndrome called holiday heart syndrome, which is when the heart goes into an abnormal heart rhythm, a very fast, irregular heart rhythm, simply from drinking a little bit more alcohol than you used to.
Now, is that something that stays with you, or does that go away after your trends kind of change after the holidays are over?
Well, it can just last a few minutes or it can last a few hours. And I will say that if you do notice that your heart is going fast and irregular, and you happen to be feeling lightheaded or weak or dizzy or having any chest, arm, neck, throat, jaw discomfort, then you should seek medical attention right away. If it goes away after a few minutes, just stop drinking, but talk to your doctor about it afterwards.
And that's my question, too, that I want to ask you as a doctor, because a lot of times we might feel some type of symptom of sort, perhaps a minor one, just because of the stress. How do we know if it really is something dangerous to our heart, or if it really is just like, okay, let's just take a breather for a few minutes and relax, and hopefully this will get a little bit better?
Well, you know, that goes back to the regular warning symptoms of heart attacks and heart pain. If you're having heaviness, pressure, squeezing in the chest, radiates to the neck, the arms, the jaw, you break out in a cold sweat, you're feeling more short of breath with simple exertion, for those symptoms, you need to seek medical attention right away. You have a little upset stomach because you really overdid it, you know, take a little something and see if you feel better. And the other thing I always mention to Allison, and whenever I come on here, we have to remember that women have as much heart disease, if not more, than men. And women tend to think their symptoms are not heart-related. More women die in this country every year of heart attacks than men.
Do you find a lot of times, too, that, and we always hear about the pre-existing heart conditions that maybe people weren't aware of, things like this just kind of amplify that if you already have a condition, perhaps?
Absolutely. Well, the holiday heart syndrome, when the heart becomes fast and irregular, that can be the first symptom of underlying heart problems, and that's why you should have it checked out. But heart disease is a silent killer, and that's why we come on all the time and say, know your numbers, know your cholesterol, know your risk factors. You need to get to it before it gets to you and be proactive.
Well, it sounds like we're just being a big downer here before the holidays, but the point is we want to make sure everybody enjoys the holidays, right?
Absolutely.
And beyond.
Absolutely. And if you're having a problem, get in. You'll ruin the holidays more for your family if you wait too long.
That's great advice. Dr. Levy, thanks. Always a pleasure. Allison, back to you.